Wrist joint is present between and type. Wrist joint is between radius and carpal bones and its condyloid, ellipsoidal, synovial joint. Pop position in both bones, fracture of forearm. Proximal 1/3 supination, middle 1/3 mid-prone, distal 1/3 pronation. What's Monteggia fracture? Fracture of upper 1/3 ulna plus proximal RUJ disruption. Monteggia fracture classification. 1. Radial head dislocation anterior. 2. Posterior dislocation. 3. Laterally. 4. Anteriorly plus radial fracture. Treatment of Monteggia fracture. ORIF plus K wire to stabilize Prouge. Most common complications of Monteggia fracture. Posterior interosseous nerve injured, branch of radial nerve. Causes finger and thumb drop without any sensory deficit. Reverse Monteggia fracture aka and what is it? Aka Galazzi fracture. Piedmont fracture. It's fracture of radius plus DRUJ disruption. What's nightstick fracture? Isolated ulna fracture. Self-defense injury. Nerve injured and posterior dislocation of elbow. Ulnar nerve. Articulating surface of radius points toward what in lateral and AP view on X-ray. Lateral view, points toward volar surface palmar. AP view, points toward ulnar surface. Fractures at wrist and which are intraarticular and extraarticular. Cole, Smith, Barton, Chauffeur, upper 2 extraarticular, lower 2 intraarticular. Cole's fracture what and its common in? It's fracture of distal end of radius at cortica cancellous junction. Common in elderly postmenopausal woman. Displacements in Cole fracture. Dinner fork deformity. 1. Dorsal tilt. 2. Lateral tilt. Position of pop application in Cole fracture. Hand shaking position. Complications of Cole fracture. 1. Stiffness of finger MC. 2. Meloonian dinner fork. 3. SU deck dystrophy. 4. Extensor pollicis longus tendon rupture. 5. Carpal tunnel syndrome. What's done to prevent stiffness of fingers as a complication of Cole fracture? Cole's cast applied below elbow. Position, palmar deviation and supination. What's SU deck dystrophy? It's nerve injury due to Cole fracture, resulting in autonomic system mismatch so tense swelling, shiny skin tingling numbness paresthesia occur. What's Smith fracture and deformity here? Extra-articular fracture of distal end of radius with volar displacement. Deformity, garden spade deformity. Mechanism of injury in Smith fracture. Fall on outstretched hand with wrist inflection. Barton's fracture. Intra-articular fracture of distal radius plus carpal subluxation. Chauffeur fracture aka and what's it? Aka driver's fracture. It's isolated radial styloid fracture. Intra-articular. Carpal bones names and largest smallest. Scaphoid lunate, triquetrum pisiform, trapezium trapezoid, capitate hamate. Most common carpal bone to fracture. Scaphoid. Most common carpal bone to dislocate. Lunate cause median nerve injury. Parts of scaphoid and MC site of fracture. Tubercle, waist, proximal pole. MC site, waist. Clinical features of scaphoid fracture. Pain, swelling in anatomical snuff box. Investigation for scaphoid fracture and best view among them. X-ray oblique view, best. AP, lateral. Complications of scaphoid fracture. Non-union, avascular necrosis of proximal fragment. Types of scaphoid fracture. 1. Distal pole fracture. 2. Fracture at wrist, MC. 3. Proximal pole fracture, MC. Risk of complications. Treatment of scaphoid fracture. 1. For undisplaced fracture, pop application in glass holding position. 2. For displaced fractures, or if with Herbert screw. What's Terry Thomas sign? It's increased gap between scaphoid and lunate because of SCPHO lunate ligament injury. More than 3 to 4 m. Osteonecrosis of lunate is called Kahnbach disease. Types of carpal instabilities. Lunate dislocation, perilunate dislocation MC. Sign seen in lunate dislocation. Spilled coffee cup sign. Maneuver for reduction of perilunate dislocation. Tavernier maneuver. Fractures at base of first metacarpal. These are intra-articular fracture of trapezio, metacarpal joint. 1. Bennett. 2. Rinaldo. Displacing forces for fractures at base of first metacarpal. Abductor pollicis longus pull. Difference between Bennett and Rinaldo fracture. Both occur at base of thumb. Bennett fracture is characterized by single oblique fracture, resulting in one fragment. Rinaldo has comminuted fracture, so multiple fragments. Boxer's fracture. What? Articular type, pop application pose. Fracture at fifth metacarpal, it's extraarticular, pop application in James position. Mallet finger. Due to hyperflexion injury, injury to extensor digitorum communis tendon, so flexion at distal phalanx. Examination findings of mallet finger. Extension at dip joint, present passively but absent actively. Jersey finger. Hyperextension injury, so injury to flexor tendon, causing extension at dip joint. Examination finding in jersey finger. Flexion at dip present passively but absent actively.